snap, yeah, group picture.
So I think a few people are still joining. Maybe we can try again
So
after
maybe in the middle
sometime.
session we can try once. Yes.
Yes, yeah. So anyway, you've taken one picture now. You can take one later as well.
Later. Sure, ma'am.
Yes, ma'am.
Sure. You can start, Ragini, please.
Okay, everyone, again, once again, for everybody who's joined now, welcome to the session. Before we begin, I would really like to introduce our speakers. So we have three panelists with us today. We have Dr. Uma Nambiar, who has over 3 decades of comprehensive experience in healthcare industry in India and abroad. She's a neurosurgeon, she's a healthcare administrator, and she's an international healthcare consultant. And at present, she's a consultant at Bakchi Parthasarthi Hospital and IISc Medical School. And she's also the chairperson of DH India Association. So first of all, welcome to the session, ma'am, and thank you for joining us.
Thank you so much, Ragini. Thank you.
Our other panelist is Mr. Saurabh Gupta. Sir has over 2 decades of global experience in hospital operations, business strategy, marketing, and management. He is an NABH assessor and a certified auditor for Quality Control India. And at present, he is the regional chief operation officer at KIMS Hospital. So welcome, sir, and thank you for joining us.
My pleasure. Look forward to the session.
Thank you, sir. Our last panelist is Mr. Avinash. He has 15 plus years of experience as an EPR implementation. He has worked in the fields of digital transformation. He is a leading healthcare in the leading healthcare institutions in India, US, Middle East, and the UK. He is a Prince 2 certified EPR consultant, and at present is the EPR expert with Candid Health Systems Consultancy Limited. Welcome, sir, and thank you so much for joining us today.
Thank you, Ragini. It's a pleasure.
Thank you, sir. So before we move forward, I would request Mr. Piyush Kumar, who is the Associate Professor and Associate Dean Trainings at IIHMR Bangalore, to please give us a brief introduction about IIHMR.
Yeah, thanks, Ragini. It's a pleasure to welcome everyone, Dr. Uma Nambiar, Mr. Saurabh Gupta, and Mr. Avinash, and all the participants to this forum. I'll just take a quick 30 seconds to give a brief about IIHMR. So IIHMR stands for Institute of Health Management Research, and our journey started way back in 1984, where we started from Jaipur with a premier university in healthcare management education. So in 1994, the organization moves towards academic from just being a public health research organization. So we introduced a course for postgraduate diploma in healthcare and hospital management. I would say perhaps the first one to introduce this into the public sector, private healthcare sector. And so since then, IIHMR has been actively working on integrating the different aspects of healthcare and developing the capabilities into the healthcare. As of now, we have 4 campuses. One, the main university in Rajasthan, that is IIHMR University. One campus we have in Delhi, and one campus we have in Bangalore, from where we operate. We look after the South chapter of India. Then we have one research campus in Kolkata, where all the research activity is being done. So there are typically main 4 pillars of IIHMR Bangalore, which makes it like a very strengthened institution, which is one is academics, as I just told, the 2-year full-time premier program of healthcare and hospital management. Recently, we diversified into the healthcare IT management, which typically is the digital health, understanding the demand and need of the hour. Then pharmaceutical management. Second is consultancy. We are certified for NABH consulting. We have capabilities of doing due diligence, hospital feasibility studies, and also the research. I mean, we are since long, NFHS has been connected by IIHMR. There are many institutional partners like UNICEF, World Health Organization, and ICMR, for whom we have been conducting various national and international research. And then there is a segment of learning and development, which works for the industry professionals, developing the course for upskilling and for addressing the skill gap in the industry. And that is which brings us here today, where we discuss about what are the various opportunities and the skill gap when it comes to the digital health or I would say the healthcare itself as of now, and how do we address that? So that was a bit just about IHMR as an institution and the capabilities. So without wasting even a second now, I would request Ragini to kindly kick off the sessions, which we have been waiting for a long time. Yes.
Thank you, sir.
Thank
So
you.
as we begin the session, my first question is to Uma ma'am. So, ma'am, as you know, we've been talking about digitalization. We want to know how it's going to impact our sector. So if you could just give us an overview of what kind of roles and responsibilities and career growth scope you see in this sector for us in the future.
Thank you, Ragini. First of all, let me just tell the participants that I have put my video off for most of the session because the network is not that great. But oh, okay, you want me to start my video? Okay, I will do that. But if in case in between there is a problem, I will switch it off. Okay.
Issues, ma'am.
Yeah. So let me welcome all of you, and all of you are from the healthcare sector, and some of you have introduced yourself in the chat. And it'd be good if all of you write a line or two about yourself, so it helps us to understand where you are from, at least which city you're from, which hospital or organization you're from. So that in the last so many years, we have been, there has been a lot of challenges in healthcare, and everybody's been wondering how to address the issues of access in healthcare, address the issues of quality, address cost-related issues, and all of that stuff. And nobody really has an answer to all that. But there is a feeling, and there was a feeling, in fact, that if we digitize the healthcare system, a lot of these issues will get addressed. Now, although the digital tools have been available with us for the last so many years, but we were not very quick to take advantage of it. And it has taken us COVID to really make us realize that it is possible to address most of the healthcare challenges, especially regarding access and cost-related issues, and also in quality, by using digital tools. Now, how did this come about? I mean, before that, what was the problem? Before that, of course, we always felt that if we didn't see the patient, didn't touch the patient, we were not in the same physical space, it was difficult to come at a diagnosis, and doctors did not have the confidence that they can pull it through. And also the patients were also very reluctant. But when COVID happened, all these assumptions were put to rest, because we realized that it is not true. We could make remote diagnosis with ease. There were a lot of technologies that developed that could do remote healthcare, whether it was in diagnosis, monitoring, and care. All that could be possible with use of digital technologies, and patients became very confident. Doctors became very confident, and healthcare systems also realized that it's a great vertical. There is you can optimize so much of your healthcare delivery by actually dividing between remote healthcare delivery and on-site healthcare delivery. So acute healthcare, you do it in the hospital. Chronic healthcare, follow-up care, you do it as, in remote location. So patient is also not disturbed, their jobs are not affected. So and while this has been happening, even before COVID, Government of India has already come up with standards for EMR. So there's this in 2016-17 is when the first standards for EMR were written and were published. And then telemedicine practice guidelines came up in March 20. And now we know that Ayushman Bharat Digital Health Mission is happening, where government is expecting every hospital to digitize their records and submit certain structured data fields to the government, so that they could do the insurance support to the healthcare industry in the government as well. So all this is headed towards more and more, and in fact, a complete digitization of healthcare records in India. Government of India is very, very keen. And over the next 5 years, you'll find most of the government hospitals would have been digitized. And private healthcare, we are divided. I mean, I think 60 to 70% of them have some form of digitization or the other, the large enterprises. the smaller hospitals will have to also start looking and working at it. So there is no escaping the digital implementation of digital healthcare system now. Digital transformation is happening and happening now and happening with, I would say, uh, at a momentum where over the next 5 to 10 years, we would be completely digitized, and there's absolutely no doubt about it. What will happen is we will be headed towards what is called a PHR, that is a personal health record of every citizen, which will be available to every citizen, like linked to their Aadhaar card or their Aabha ID. There's a digital health ID in India called the Aabha ID. It'll be linked to Aabha ID, which is very similar to our Aadhaar card or the national ID card number. And every patient will have full control of their data, and they will be able to give access to the doctors or whichever hospital they go to, so that there is a seamless integration of the entire healthcare journey of an individual. So every citizen's literally cradle to grave documentation of health will be on the PHR, and that is the dream of the Prime Minister, and that is definitely going to happen. Now, in this scenario, what is it that all of us in the healthcare provider space have to do? We need to start leading this journey, because when you talk about digital health ecosystem, it's about accurate data entry of a patient. So 50% of the job is that of the doctors, nurses, technicians, or the healthcare provider system. And 50% is about the patient giving you the right data. The data that is available from the patient has to be entered correctly, because if there is no correct data entry, there cannot be a good, robust digital health ecosystem. So the first thing for us to understand is that we need to make sure that what we write on the papers as accurate data has to now be digitized. So this is our main responsibility, whether we are directly in the space. Like I obviously, now if I'm not seeing patients, I'm probably not entering data, but I need to make sure that in my hospital or in the space that I work in, all the people who have to enter any data, it's either entered physically by them, or it is interface from the equipment and all that, and there is an automated data entry into the EMR. So that's how data will be captured, is one aspect. So data capture is a big responsibility of the healthcare provider ecosystem. Once that is done, then this data is analyzed, and there is computerized decision support systems. There is also, mechanisms by which you get, we will, in future, there will be personalized medicine and, will be provided to the patients. So we are going on that journey. So how is it that we need to now relook at ourselves? This is an innovative tool. It's nothing to be afraid of. And I want to tell everybody that there's nothing that, one has to be afraid of. It is just a method of data entry. How we use pen and paper, similarly, now we are going to use digital tools, whether it is your laptop, your computers, your PDAs, or your IoT devices, whatever it be. It's just that the tools of data capture are changing. The tools of data analysis, which was just the physician's brain or the healthcare worker's brain at one point of time, now it is a collection of, many such intelligent inputs and analytics by using the computing power and getting better analytics, and therefore better diagnosis and better decision support for management. So improvement of the healthcare quality. So there are many new jobs that will open up. There will be data entry scientists, there'll be data analysts, there'll be functional data, analysts who will interface between the healthcare worker and the software technology person. As far as the healthcare delivery, the people in the healthcare space today are concerned, we all have to change. We all have to learn the new technology, because if we don't learn, we will get left behind. There is no doubt about it. And another thing that I want to really emphasize is that this is about healthcare data. We in the healthcare space know this data and the data analytics much better than anybody else. So let us make sure that we take the leadership roles in wherever we are, And we lead this game of digital health ecosystem, creating the robustness, making sure that it is used correctly, and don't leave it to a political system or a bureaucratic system to tell us how we have to do it. Because that's not the correct way of implementation. We need to also learn how to partner with the software technology developers, work with them to make sure that we work from the same side of the table and understand how this has to be implemented very well. So the relationship with them needs to change. And the software technology developers, who are also, I would consider them as part of the healthcare provider ecosystem, they also need to make sure that they meet the needs of the healthcare providing community of doctors, nurses, and technicians, as well as for the patient. So this is how the system is going to develop. We are looking at a future where there is no role for people who have not learned the digital tools of the trade. This is the only way that we can go forward. And it is our responsibility to train ourselves first, and then to train all the people around us to make sure that they can implement this. See, 5 years down the line, when the new healthcare workforce that is in training today, in their curriculum, digital tools, additional technology is going to be, added. NMC is working on adding it in the MBBS curriculum, the nursing, technician, everybody's curriculum, this will be added. But it is the workforce that is engaged today, because we never learned all this, that now we need to make sure that there are ways in which we can enhance our learning. And this course is actually a preamble to make you understand as to what are the realities of implementing such tools, implementing EMRs in your organizations, implementing HIS in your organizations, also understanding what are the different softwares in the hospital and how will you make sure that all of them work together, and how the healthcare leaders of today will adopt to digital technologies. That's the, that's the purpose of this course, is to make you ready for this, for being very useful, playing a useful role in this ecosystem development. So this is what I wanted to share, and I'm happy to answer any questions that anybody has. And let's hear from Saurabh and Avinash as well about their views on how this course will develop people who are participating in this and how they can, make things better. So over to Ragini.
Thank you, ma'am. So adding on to what ma'am said, my next question is to Saurabh, sir. So like sir, ma'am said that we have an ecosystem that we're looking forward to build on. We have a lot of data entry roles that will be there. We need a lot of data analysis to be happening. So is it true that we will need true hardcore IT professionals to be working in this digital health and to lead and to understand digital health more?
It's a clear-cut no, because see what role we will be doing. See, as hospital administrators or CEOs or CXO, our job is to be an enabler for the healthcare workers to actually provide better care. That's what all the healthcare workers do. We are not actually there to impart the actual healthcare. That will always be done by the nurses and the paramedics and the doctors. So what digital course will tell you is how to maximize the reach of the healthcare, because I was listening to what Dr. Uma Nambiar ma'am was saying. See, we need to understand that the resources in healthcare, and this is more to do with the macro picture. I'll come to the micro picture later. Well, macro picture, if you see, the resources in healthcare throughout the world, and especially in India, will always be scarce as compared to your space funding or, defense. People talk about GDP spend, but GDP spend will grow up, but you cannot compare it with other sectors. So there will, with the population explosion, and now we have the, largest population in the world, they will always scarce. So digital is the way forward, because you can maximize the reach to the population. So that's the macro perspective. So you need to understand how to use digital. Like there are a lot of things which relate to productivity. So there are remote monitoring devices available. You I'm not very sure whether there are things like tele-ICUs, which actually have seen the light of the day after COVID. So even in tier 3 cities, specialized critical care was provided. Now, this is, of course, talking about the society community as a large. What does it mean for individuals like us and the participant? So, first of all, the hard fact is, be the part of it or you will be left out. So eventually everybody is going towards digital. If we as healthcare professionals do not understand what is going on, it will actually be very difficult, because people will come to you, people will talk digital, and you don't understand, you won't be able to evaluate the systems. There are things very, I think, exciting things happening with AI. So now, very soon, we will not require to report all the X-rays. The X-rays will eventually, only the X-rays which have problem will come to the desk of a radiologist. No, just see the type of productivity it will increase. You need not scan any documents or the prescription. What will happen? The software will automatically digitize that. Now we need to understand all these things, all the modalities which are coming. So as individuals, I think it's vital. It's one of the most important skill sets to actually take. And IT, IT skill set, if somebody has that, very good, but that's not what it is required. Basically, you need to understand how digital can help, the basic terminology which is used, and as CXO, the best thing or the most critical thing would be to evaluate what will eventually make difference to patient care, to the top line, to bottom line. And for that, you need to have exposure to the digital learning. And that's what this course will actually add.
Thank you, sir. So just adding on to, like sir said, that we need maximization of reach. My next question is to Avinash, sir. So, like we keep hearing, we've heard a lot about AI, we keep hearing about tools like IoT, we keep talking about telemedicine. So what exactly are the technologies that are currently deployed in the healthcare sector? And why has it been deployed? How do you think it has been helpful in the sector?
Thank you, Ragini. So, as Dr. Uma and Saurabh has already emphasized on, like, digital is the way forward, right? So there is no escape to it. The reason being, like, as a consumer, like, the patients have slowly turned into a customer. I actually, because it's more of like the affordability has improved over time, with the people are now more demanding. They have access to internet, so they can search. And so what they try to do is basically they look at the world. They're not just looking at what's available around us, what's available in India, or what's available in your state or in your town. What people, because they have money and they can buy, and in India especially, we have public healthcare and we have private healthcare. So, and we know the population that mostly we cater to is private healthcare, right? So the people who actually spend from their pockets. So they when people spend from their pocket, they want the best. They want the best out of everything. And so it empowers the patient when they have access to better facilities, and better facilities means more transparency, which is obviously available when we have in a digital world, right? So that actually opens up a clear answer on where we are leading to. When you can order a pizza, when you can order food, when you can order your medicines or clothes or anything over app. That's what people are expecting today, right? They want the access to the healthcare as well through the same way, it as easy, as accessible as it is for the rest of the thing. They compare it, and as I said, we have patients are a mix of who go for who are in need of healthcare versus now people who are more you could say they are more caring about themselves. They go for health checks, they find out about their health, and they're more cautious about what's happening to them. So this requires a digital world to be available to them. They want the access over the phone. So talking about the technologies, the basics, we started when government started thinking about it. It was about bridging the gap between how to connect the mass with the little workforce that we have. So how to give access to the healthcare to remote areas. So telemedicine came into picture. So that was the need. Now the need is, as people are demanding, the need is going towards digitization of records. And as Dr. Uma emphasized, even the government wants all the records to be digitized. That's both. It is digitization of your medical record as well as digitization of your health record. So even people want to carry a record of their own medical information. Reason being, we do not stick to one particular hospital. We do not stick to one particular doctor. So having control over my own healthcare will empower me going anywhere and quickly, without wasting any time, with lesser number of visits, with less amount of time, get the maximum out of my one consult. Otherwise, it's going to be, okay, you carry a bunch of papers, the doctor studies it. So of your 1 hour consultation, if something's not legible, not, obviously clear, you're not going to get the best out of it, right? So, and people understand the risks of not having the legible information with them, or not having the complete information. So digitization is imminent. So from telehealth, the hospitals have to implement EHRs, and a lot of hospitals are starting to implement EHRs. We interchangeably use the terms EHRs with EMRs and EPRs. Basically, they are expanded form of each other: electronic patient record, or electronic medical records, or electronic health records. So basically talking about the mobile health. The digital world, I'm not talking about the digital health, but the digital world, like even consumer devices like mobile phones, have started giving you, probably they wanted to expand the features, and they ventured into the healthcare space, giving you the sensors for just checking your pulse and other stuff. So they have forced the healthcare industry to now, because they are being encroached, the healthcare industry is now forced to enter into, to reclaim their space back. They are forced to have control over this thing. So they are now partnering with these wearable devices companies and the mobile companies to have validated data to ensure that what is being captured is right and is somewhere of precision. Then health information exchanges, that's a new reality coming up today. That's now as it is difficult for even a patient to carry the detailed medical information. They can carry a basics of overall picture, but when you talk about the micro events that happen in patients' stay in the hospital, those have to be carried in somewhere in the exchanges, right? So somewhere similar to how we have exchange the financial information today in the exchanges, the health information is also captured in the exchanges in the Western world. And this is going to be a reality because India is on the digital journey. So this is going to be the tomorrow's need. Artificial intelligence, it's coming in as sort of cited already. We don't have enough workforce to go through each X-ray. It has to be, so most of the normal ones should be really quickly reviewed automatically, unless there's a problem that's identified. There's something that's concerning that's identified by the AI data. Only those will be tagged and to be reviewed by the the radiologist, the medical staff. Otherwise, the rest of it has to be reviewed by AI, and that will bridge the gap, for the future, for the population that we have. Then we can talk about the wearable devices. That's for the care, for quickly discharging the patient and then still keeping an eye over their health. This is already in place, right? So Apollo is doing a program, Manipal is doing a program for surgical patients. There are pilot studies going on. So those are some of the important technologies that are being currently deployed in use. And if we tap them today, if we sensitize ourselves today, that's where we can actually be part of this important journey. Over to you, Ragini.
Thank you so much, sir, for highlighting all the technologies. Circling back to Uma, ma'am. Ma'am, like sir has mentioned that we have a change in the customer pattern. They are empowered, the patients are more empowered. We are using a lot of technology to back us up now in the healthcare sector. So what skill set do you think that the professionals would need to advance in their careers now? And how do you think they will be best able to acquire it?
So there are few things that we must understand. One is that the concept of how the patient is seeking healthcare today is changing. Okay, and there's an interesting question that was in the chat box about preventive health. Okay, now if you really know, in the last 3 years of the COVID pandemic, all of us have realized the value of wellness. We have realized the value of more investment in public health. We've realized the value of collating all the health data and ensuring that we remain well at all times. Now, wellness, if we need to really focus on, we need a lot of data points to be collated and analyzed and then give us the information on how to continue on a wellness journey. We use this data to nudge the people's behavior to bring about the appropriate modifications in their lifestyle or behavior, or to ensure that they remain well and don't fall ill. So this is a major shift, because before that we always only worried about acute episodes, right? So we have that as a major change in the health taking behavior. The second thing is, of course, about managing the acute care. Okay. So as I had mentioned before, what do we need to do? We are in the delivery space. So we need to be able to meet the customer's expectations. And a lot taking from what Dr. Avinash had said, is that, we have to meet that customer's expectations, who is expecting healthcare to be delivered exactly as he does an online purchase of any item. So healthcare is also going to be an online purchase for majority of the items, except when the patient requires to be in the hospital for an acute healthcare event. Additionally, the other than just the direct healthcare delivery, all the ancillary items, whether it's a pharmacy, there's labs, diagnostic centers, there's insurance claims, all of that also is going to be digitally linked. So we are going to have a very closed system. And in this, we need to be able to not only work, we need to survive this ecosystem. First, we need to create, therefore, it is important that we use all our knowledge to create that ecosystem very well, so that we can survive well in this. And for that, there is no doubt that we need to understand how the digital tools work, and we understand how it is to be implemented and deployed. That's the major focus. And in this course, our focus is on taking you through that journey of implementing digital tools in your healthcare arena, whether you are working in a public hospital or a private hospital, or you're working in a healthcare affiliated ancillary industry, or whether it's pharma, lab, any of the ancillary industries, or if you're just uh, a citizen and trying to understand how digital health will impact you. Even for them it is helpful. If you are a software technology person, it will help you and so how to uh, speak to the healthcare providers. So we are going to make sure that in this journey, and this is, we put together all this curriculum with discussions from various people who have been uh, part of this digital transformation journey in their own organizations. They are going to share their experiences. They're developing this for future. They are improving their technologies. So that's one. And as healthcare provider, it's also necessary for us to not shy away from speaking to the software technology developers, and to understand what they develop, and to have a very, very clear understanding of how we can leverage this knowledge to ensure that we can do a very good job in our workplace. So the entire course is designed to teach the participants on doing this, or actually enabling them to take this digital transformation in their own workplace. And what we also intend to do is that if you are registered with the course for the next 1 year, IHMR will, conduct another 2 or 3 short sessions, which are complimentary as part of this course, to handhold you and address your problems as you face them. So you can request for, such sessions, and we can, we'll make sure that for the next 1 year, we do handhold you to at least make sure that the problems that you face, because I'm sure we may not be able to address every issue that you may face at your workplace. All of us will face different issues. We'll try to address those needs of yours as well. So our job is basically in this effort is basically to prepare all of you to be able to digitize your workplace, to be able to train your uh, workforce that works with you, to be able to train your clinicians, to tell them how not to be afraid of it and to give them support, and to be able to educate the patients as to whenever they get a PHR, how to use the PHR. It's a long journey, and this is a beginning that we want to make.
Yes, I think, and ma'am, if I may add, that's the most important thing which is missing in many of the places as of now, because people just come, learn few fundamentals and then go back, but how to address them in the practical life, how to solve their problem, there needs to be a constant hand holding on certain aspects. So that's the key differentiator, I would say, which is a part of this course, so that we have a huge faculty backup from national, international backgrounds who would be supporting as far as possible for all the participants in actually implementing these fundamentals, which will be taught during the courses.
Thank you, sir. So my next question is again to Saurabh, sir. So like we have right now been pushing towards digitalization. We know that it is imminent that change is going to happen. But if you could just draw a parallel for us about the challenges that we are facing right now, because we are not adopting digitalization, because there is a lack of awareness, there is a lack of technology in a lot of sectors. So if you could just tell us the challenges that you have seen around you in your workplace that we are facing because we are not moving towards digitalization at that faster rate.
Okay, I think this is a very good question, because we all, and as healthcare actually is not one of the primary industries to adopt digitization, we have not been able to harness the power of digital, I would say, as compared to other industries. So it started a bit late in healthcare, and still there is a attitude issue. So I keep on talking to a lot of people, and still people want to do it the same old way. They say digital se kya hota hai. But let me tell you what happens. So 5 years back, I was working as the head of strategy for one of the leading chains in India. And that time, the number of patients, or you'd say the revenue pie from digital was 5%. It has grown to 14% within 5 years, and the CAGR is around 29. Despite the fact that they have actually not invested the time and money they should have. So we are not just talking about, community outreach. We are talking about how hardcore numbers. We are talking how we can actually use digital to build business, to grow exponentially. Because what is happening is, the first issue or first challenge is to actually make people understand. And this is exactly the problem with the education, that people have not undergone in digital schooling. So as part of the MBBS curriculum or even MBA curriculum, and now I'm happy that IIHMR Bangalore has actually taken the lead in giving some digital curriculum or digital modules to the student. But still majority of the MHA or MBA programs do not have a digital course or a module, which is a problem, because these people, when they go out, they don't know the power of digital. So it is very difficult to make them understand that this is the digital which will actually take your hospital, take your healthcare organization forward, which will also help you to build a business line. And of course, there is a bigger aspect, which is the patient education and the preventive healthcare. It is not only the responsibility of the government. We equally are, responsible for it, and it will be forced. Because once we have the data, Dr. Uma ma'am was talking about the personal health records, the ABHA ID, all your insurance payment, your the money which you pay, the quantum of co-pay, everything in the next 2 to 5 it will be linked to your personal health records. How well you are, how many what type of lifestyle you are following. So ultimately it is very important for us to understand that it is also a tool for preventive healthcare, to actually sell our preventive services. Now challenge again remains, the biggest is that to make people understand the power of digital. I've been actually struggling. Even some of the top-notch CXOs in the country, they don't understand, and they lose business. They lose patient trust, because they are not able to. None of the sorry to say, but none of the organizations in the country is able to do end-to-end patient care. Apollo tried, many people tried, because patient journey starts much before a patient lands into a healthcare facility. It is basically and it carries on after he's discharged. There are follow-up calls. Digital is the savior, because digital plugs the gap, because hospital is only the acute care. What happens before he makes the decision? And some of the hospitalizations can be avoided, because if you see the Delhi index, India has a very high disability adjustability index. So that's what are the challenges. The attitude is a problem, which remains the big issue, because it is very difficult for us to convince some of the top CXOs to actually go for that.
Thank you, sir. And coming from a medical professional industry, I can agree with you that it is very difficult to change that attitude. But again, see, we have now been talking about that we have a lot of technologies coming up. So Avinash, sir, if you could just highlight a few technologies that you think that the professionals should keep their eyes on, so that whenever and wherever they want to start getting into digitalization, that would be a good place for them to start off. So a few trends that you think that are coming up that will help the professionals gear up for this digitalization movement.
Sure, Ragini. So, as I said, like there are different aspects to the digitization of the ecosystem, digital health space, right? So, there is a payer space. Like if someone's interested in working into the payer industry, like the claims, third-party claim administration, now they are getting digitized, right? If you see, if the patient goes into the hospital nowadays, it's not, no one, like they're trying to ask not just faxing, they just scan, which is automatically picked up. They prefer, and that is the future. They would have more ready access and more structured access to the healthcare record, so that they can scrutinize whether this is a true claim, or whether it's coming in the right form, whether the right ask is. So they will be asking for more demand. So that will be a pressure even to the hospitals to go digitize. So there are roles to play in the payer industry. So there will be digital health roles in the payer industry to do that job. There'll be roles within the healthcare industry and within the hospital space. If I say, there are segmented systems which are currently being utilized, especially in India. We implement HIS, like we are focused on billing. We should have itemized billing. So the hospital is more worried about having itemized billing. Each test, each investigation should be billed, each consultation should be billed, the inpatient, outpatient, and so on and so forth. You want itemized details of every service, and that is billed. So that is digitized. We are trying to enter as much as we can gain on it. But the future is how to avoid the issues, the legal aspects, like avoid medication errors or issues that can take the hospital lose money on the legal fronts. So that is the digital space. So working on the EHR, EMR products is as an EHR, EMR analyst or in the hospitals, working as the change analyst, like even to implement a new system requires a specialized job. So you could work with the EHR, EMR development companies to work on implementing these, testing a new change. When they implement something, there's also from time to time it needs upgrading. So you can be a change analyst in that. You can be you can work in the medical device firms that do develop the devices. So being a lot of people in who do MHAs today, or who work in the medical industry, they are clinicians by background. So for them, they also have opportunities in the medical device development companies, in pharmaceutical research, clinical research, AI, artificial intelligence. A lot of data is generated, but how to intelligently analyze that? So behind the scenes, the work being done in the AI space is also an opportunity for us to venture into, and that is also going to give us some job opportunities. It is giving us, a lot of people are currently working on it, but the sooner you enter it, the higher you reach, right? So if you are entering in it today, it's a high paying job, because not many people are, there's less competition. So these are some of the ways, and this also makes you global, right? Once you are into this space, you are not limited to working into one particular area. You can move to places that give you a wider experience, give you more challenges. Over to you, Ragini.
Thank you, sir.
So Ragini, I just wanted to add one thing, is that
Sure, ma'am.
one has to understand that digital as a tool is sector agnostic. Okay, it is not specific to any sector. All sectors benefit from it, and as Saurabh had mentioned earlier, that there are other industries that have taken over, that have actually implemented digital technology and achieved their transformation far earlier, whether it's the banking sector. We all know about travel and the tourism industry, how they have been taken. So just so that we understand that and we learn it from those players, in this course we also have people who will interact with the students, and they are from other industries, not just from the healthcare industry. So whether it be other consulting space industries, whether it is be fintech, so we have people from other industries who will tell us about their journey, so that we can learn from them. How did they adopt in banking, what challenges they faced, and how did they address those. We have to do the same journey. We have to learn from them, because they've already done it, and it's all. And as far as adopting digital technology is concerned, we will have the same challenges. So we have made sure that here we have not just taken people who are working in the healthcare sector, but also try to learn from, whether it's from the automotive industry or travel industry or fintech. We've tried to get faculty which can help us understand their challenges and their journeys, and whether we will help, we can be helped through that. So that's a very different perspective we are trying to bring in this course, and we are trying to learn from people who've already done it before us.
Thank you, ma'am. So we will be moving into the question answer session. Please drop your questions in the chat box. Meanwhile, I'll take up one question that ma'am has partially answered. So there is a question that says that what's the larger public interest or digital scope of technology in preventive health management specifically? So Avinash, sir, if you could address that in public health specifically, because we do not see so much of technological advancement. So what do you think would be the larger scope in that sector?
Like for public health, as Dr. Uma had cited earlier, the government is taking initiatives to implement this thing, and this, one of the reasons is when you have a digital identity, it is easier to track on what's your penetration in the public health, right? You can track their vaccinations, you can track what kind of preventive programs are being accessed and how far they have reached. So the telemedicine obviously is another aspect of that is, that has been there. It has been there for long, but since we have now improved a lot on the connectivity, we have improved a lot on the bandwidth of the devices that we use. Now even our simple smartphones have quite a good bandwidth, so even people can use simple devices to use it for for a far
bigger population. So from public health point, it is easy for the government and even private sector to now reach the larger space. And in turn, that actually turns people, as I said, people are now ready to spend money. So even when reaching the public health, this is actually going to churn out a business for the private healthcare sector.
Thank you, sir. So we have another question related to the course. I think you sir can take it up. It's they want to know if there will be any language specifically that they will be learning during the course of the curriculum, specific digital language.
So I think Dr. Uma would be the right person to answer.
No, we are not going to be teaching coding or any languages or how do you develop your programs. Not at all. That's not the intention. This is a functional course for people who are already working in the healthcare space and who we don't need to know the language of coding. What we have to learn is how to use the software to in our day-to-day life, to be able to capture the data, to just enter in the fields and to be able to analyze that and use the analytics to make our decision better. So that's the idea. It is for people who are the doctors, the managers, the nurses, technicians. It is for them. It is not for, the idea of this course is not to make you software developers. The idea is to make everybody an implementer of software. I hope I answered that question. Yeah.
Thank you, ma'am. I want to just add on that. So, one thing we need to all understand, and I think this has been a notion in a lot of people's head that, that being digital means you need a lot of coders in the industry. But that's where the gap has been. So not everyone in the telecommunication digitization was a telecommunication expert, right? Or they were not telecommunication engineers. The same is with healthcare. You guys are expert in your industry. We are expert in our healthcare industry. As a qualified clinician, we know our industry best. With our experience, we have learned, we know we can translate the processes much better than a technical person would be able to. So don't worry about that. You are gonna play the role exactly as you do. You need to understand how best you can translate your services, how best you can make use of the digital space to make the services more efficient, to deliver to a larger mass, churn out more patients. That's where we need to be. So don't worry about getting technical, and don't get confused on whether if getting technical can increase or your opportunities to get more jobs or open more doors. Even being a functional and being expert in your own clinical space has enough opportunities for you to, and this will be true for at least a decade for you. This is the right time to enter this space, and this is the right time for you to start in any of these courses.
And I think if we may put it like Saurabh sir would be, I think the right person to comment on that. Like typically, if the managers do not need to learn the accounting, they need to know how to read the profit and loss statement. They need to make decisions based on that. They are not there to make the ledgers and balance sheets, right, sir? So I think you could just explain it in a much simpler way, that how we can segregate between becoming a tech expert and becoming a tech manager.
Okay. So let me actually tell you an example from another industry, which is very relevant. So they say data is the new oil and everybody is after data. So Fortune 500 companies, 90% of the Fortune 500 companies, including Alphabets of the world, Amazons of the world, they are into data, and they are around 72% of them are into healthcare data, because they all understand the power of healthcare data. You can make heat maps and predict a lot of those things. So the point is that they understand data is the new oil. But there are many countries in the world which have huge deposits of oil, including Libya, which is actually a poor and devastated country. 11% of the proven reserves are oil. The problem is they don't have the refining capability. So data is the new oil. But this oil will only make sense if you have refining capabilities. Now in India, we actually do more refining than we produce oil. And just for example, I was reading somewhere 3 days back that almost 12 to 14% of the Indian exports are only from Jamnagar. That is the power of refining, because they understood, that the refined oil, so that is more valuable, much more valuable than the oil itself, crude oil. So the similar connotation, if you say, we have huge data and we need not mine the data, we need not refine, but we need to understand the power of refining, the power of big data. That is what is our role. So setting up refineries, setting up the processes which uses that data to get into meaningful results, that is what we are here for, and that is the role we need to play. Just putting the right people, putting the right AI resource, putting the right system, what to automate, what not to automate, because automation purely might not be the answer. Just putting EHR, which does not, and I actually have coined a word which is manutization, which I actually speak at conferences. So we have a very good habit in India that we will have a register and a manual system. And just because there is a digital wave and somebody pushed for it, we will have a not complementary, but a parallel system, parallel digital system, which do not talk to each other. So what will happen is, instead of reducing the load, you will actually add up, putting more people and putting both the systems in place, which is actually a disaster. So that is what we need not do. And that is what this course, these type of courses tell you, what is the right blend of, digital plus manual, and where all you can actually exponentially catapult your services by using digital.
Yes, exactly.
Thank you, sir.
So
there is one last question, I think, that we can take.
yes, or anybody, if you want to ask a direct question, enable your camera, please. Feel free for a discussion over here.
So there is just one more question that has come up in the chat box. So they want to know how the program will help with the HIMS and AAMR providers. Avinash sir, if you could take up. So they want to know basically what our course will be doing with HMIS and EMR providers.
Okay, so as I said, as a clinical experts, you need to understand what exactly the process is, right? And these systems, the health information management systems or EHR systems, basically are to help the workforce make their life easy, be as real and practical as they can be, to basically enhance your job, right? And as Saurabh rightly said, they just not digitize the, they just not increase your workload to have a system which is capturing the data but not having any output or any use of that, not talking to it. So interoperability. So, and the government is laying down standards. NIH has recently come up with the digitization standards for each organization. So those will cover. So as part of this course, you will also be learning on how to make a get into the digital space, but in a useful way, in a way that's more practical, that actually is feasible, not just having a computer to, have a duplicacy of job of entering there and then taking a printout and sending it or faxing it to someone else. So the system, the data that's captured during the journey has to be ready, structured, and usable to be sent out ready. This is what we do in most of the developed countries. Here in UK, for example, you capture the information while, and that's how, if we study these systems, we as a that's one of your opportunities as well. You become a business analyst. You study the workflow. You understand what are the points where you need to capture data. What are the required data elements versus which are optional, because you do not want to become a bottleneck for a process, right? You define that, you capture the information, and the information that's required for the government submissions are required. You capture it here, someone validate it at the end and send it over. You don't duplicate it, as Saurabh rightly said. You don't want to capture it and then take a printout, do something else, and then you are struggling to find out the information that you need to submit somewhere else. The system is doing two jobs at the same time. You're capturing it digitally, which is legible, available in the future for people to easily access and take decisions on. It may be, you may use a clinical decision support system that utilizes the same data and gives you alerts on that. If there are some, if a human eye misses something, the system actually marks it, flags it for you. Also, it captures and does your submission job. So you're doing, it's a legible data. No one needs to validate it as such. Validation just means basically having a quick eye on if something looks totally outdated or totally, outside the norm. But otherwise, that should actually make your life easy. So efficiency and effectiveness is what we are looking for in the system. And this is what we're gonna learn on how to make practical and efficient systems out of the digital space. So this is what we are going to learn about it in this course.
Yeah, and Avinash, if I may add, so if somebody is a solution developer, a technology person, right now what happens is that the person who's developing the software solution for the hospitals, they don't have a clear understanding of the workflows and processes, like you rightly said. And we want to cover this gap, because if the solution has to be effectively used in the hospital, then it must mirror the hospital process flows. And what it should do, in fact, is you take the process flows and to see how it can, by reduction of duplicity and all those, to make it more powerful and efficient. And this is the expectation from a software technology. Currently, what happens, a lot of technology developers have developed something without proper inputs, without understanding the entire workflows in the hospital. And when they come to the hospital, it is not usable. And there are a lot of gaps. And because the systems are not very useful, the hospitals are, the workers then get frustrated. They cannot use it. And therefore, there is a lot of paperwork, combination of paperwork and the software work, digital, entering of partial data and all of that. So it really messes up the whole system. And it also frustrates all the users, and therefore the technology solutions fail. What we want is that if there is a solution developer, they should try and minimize their losses. They should get the right resources, right input from the healthcare domain experts, and to make sure that you understand what is the need of the hospital and develop technology for healthcare delivery, rather than expecting a healthcare organization to follow the technology that you have developed, which may not be very useful. So to really minimize this loss that is happening in the software industry also, why are so many solutions failing? Why is it that they need to get replaced by the organizations? Because, after using it for some time, we realize it's not useful. So we need to really make sure that this does not happen, because it's not very good. It's not good for the healthcare organization, which is buying technology, spending money, and after some time having to replace it. And it is not good for the technology developer, who spent a lot of money and resources and has come up with a solution which, after a while, they find it is not useful for the hospital, and therefore their solution fails. So we don't want that. So to reduce the failures in software that is developed for healthcare, it is important that we understand the processes, and we hope that this course will also help such developers to understand. So it's almost like a translation of the functions of a hospital, which they can get. So that is how we want to help.
Thank you, ma'am. We just have one last question for you. So they are a telemedicine provider startup in rural India. They want to understand how this course will help boost their business.
So, like what we said, see, telemedicine, if you really see, telemedicine is not just teleconsultation alone. It is one aspect of the telehealth ecosystem. Now, if we really see what is telehealth ecosystem all about, it's about consultation, diagnostics, remote therapeutics, and also integration with all the IoTs and devices that are available to work remotely. And as we move forward, when you have a fully developed digital health ecosystem, and if you were to look at it as a pyramidal structure, the base of this pyramid will be made from data that is collected at the doorstep of the people. The first point of data entry through Aadhaar ID will be from a healthcare worker or a telemedicine solution. So telemedicine solutions will form the first unit of data collection in a very robust digital health ecosystem. So the role for you would be to look at growing business by collecting, appropriate, required, seamless, accurate data from the periphery using your telemedicine solution, and to develop as part of the entire telehealth ecosystem, and not just remain a telemedicine consulting platform. And that's where the business is going to grow. So if you can take inputs from this and to say how collecting data through a telehealth or a telemedicine app or your solution, and how to integrate that into the longitudinal electronic health record of a patient and to cover the patient's entire healthcare journey, that's where the telehealth or the telemedicine solutions will work. So anything that happens outside of the hospital will be a remotely collected data, and that is what telemedicine is. So that's a large space. Everybody doesn't have an acute event in their life. So the larger part of data will actually be collected using remote collecting tools. And that's where business will grow. So I think it's for you to see where you can plug in, what are your resources right now, and how do you want to channelize your growth to make sure that you are in that data capture, because data capture is a major thing, and telemedicine is a data capturing tool.
Thank you so much, ma'am. Thank you to Saurabh sir and Avinash sir as well for being here on our panel today. Since we have run out of time, unfortunately, we would have to close today's session. So thank you everyone for joining in. Thank you to our panelists for giving in their inputs, very valuable inputs. And thank you, Piyush sir, for organizing this. So
I request participants, they can share the questions with Andrew, Mr. Andrew, and we can individually answer them later, maybe tomorrow or day after. But all the questions will be answered. Please feel free to connect with us.
Thank you, everyone. I think we'll close the session for today.
Yeah, thank you, everybody.
Thank you, everyone.
Yeah.
Thank you, ma'am.
Thank you. Thank you, Ragini.
Thank you, Mr. Saurabh. Thank you, Mr. Avinash. Thank you, ma'am. Thank you, Ragini. Thank you.
Thank you.